All right, Mike, today we're going to show our viewers the best and the simplest way to stop ankle swelling and pain associated with it. And we're going to do this for people who have severely sprained ankles, sprains from a ankle sprain, or simply edema, which a lot of elderly people do have. So what say you?
Stay tuned.
Okay, then.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, so typically as therapists, we always recommend exercise, motion to get the swelling to improve, decrease pain. However, there's three instances where it just doesn't work. The first one is some people simply refuse to do exercises. I had one patient, she told me right out, I am not doing exercises. I can tell you that right now. Don't give me any exercises. I said, thank you for your honesty, and I did not give her exercises because she wouldn't do them. Mike?
So what did you do with her?
Well, what did I do with her? I worked with her without exercises.
Oh.
And you'll see how we do this with ankle swelling.
Some people may have severe memory loss or even dementia, so if you've worked with people like that, you would know they don't remember they even injured or sprained their ankle, and they're not going to remember to do their exercises either.
Right. And of course, for people that are active, right, in the workplace, they have family members, they just are very busy from the time they get up to the time they lay down at night, and to throw in exercises is just something that does not happen as a result of busy, busy, busy. So
Right.
these options are really good for all of these situations, and we'll show you the first one. All right, so the answer is for these people who will not, or cannot do exercises to help, and you can do exercises with these on, but it's compression garments. Now, with compression garments, you need to know what to use so that it's going to work for you. The first one, if you have extreme swelling in your ankle, particularly with people with edema, usually elderly, this works well for, but a compression garment like a stocking like this, we'll talk more about it, they're difficult to get on if you're not real able.
Yeah, a lot of people can't bend over to their feet when they're older. So.
Right, and to put them on, it's harder than putting on a pair of nylons. Not that I know from experience.
Sure, Brad.
But anyways, what we use, and we've used this a lot over the last 15 years or so, is Tubigrip.
Yes.
Tubigrip is something you can purchase online. You can go to a pharmacy store, and they typically have it. It comes in a long roll. You can buy it by the foot. It's a lot cheaper if you buy it by the roll. And if you need it for long term, you'll buy it by the roll. It's about 10 yards worth. Okay.
When you go to the site, make sure to take some measurements so you order the right size.
Right.
Because they vary.
It goes by letters, A, B, C, D. And it goes by girth. They'll ask you to measure here, and they'll go through it if you go online, and you can get, I believe this is this is size F, okay? Just so you know. But you want to make sure you get the right size, otherwise it will not be effective.
I'm not a size F.
No, we'll see. But when you get it, you just don't, you want it to bring it just below the joint line or below the kneecap and right at the toe line, or the knuckle of the toe. We'll call it the MTP joint, but that's that knuckle of the big toe right there, and that's where you want it. You don't want it dangling over the toes, and you don't want it above the knee, otherwise there's problems. So, Mike, can you put that on?
Sure.
The way you will do it is put it on like this. Don't cut it right away. Don't guess at it. This makes it a very accurate way to do it.
Right below my knee joint there. We don't want it to crease and fold up behind your knee as you're sitting or walking. It gets uncomfortable, especially if you have edema.
And then it rolls down and creates a tourniquet effect, which is the opposite of what you want. So take a marker and mark it right there. The reason you do this is if you just measure it with a tape measure and cut it off, the length of it changes when it expands around your legs. This is much more accurate, and you know you got it right. And let's pull that off.
Oh, it's actually maybe I'm a size F. It's fitting all right.
Okay, so you can see right here is the blue mark. I cut that with the scissors while it was off of his leg. Mike simply pulled it up like you're putting on a pair of socks or a pair of nylons, and there we have the proper length. Okay, can you put your foot back on there? Now,
Sure can.
you're going to wear this. One thing, if it's too loose, you should be able to take 2 fingers, it's kind of a rough rule of thumb, and get them in there, and it should feel like it's snug. And this does, and that's good. Now, you might think this is not tight enough to squeeze the swelling or the edema up. That's a big problem, is having it too tight. Actually, it should feel, I always thought this is too loose, but that's the way you want it. It should be snug, but not too tight, because that causes, it actually reverses the effects of having positive reduction in pain and swelling. So the pain often comes from the swelling. You got the swelling, pressure in there, it makes things tender. So once you get the swelling down, the pain drops with it. Mike, you have any additions?
I would recommend having at least 2 of these cut and prepared, because one's going to get dirty after a while. You can just soak them in some soapy water overnight and air dry it.
Yes.
And switch them out. Do you recommend wearing these all day or just during the time?
Good question. Wear them all day long, not at night. So you're not going to wear them to bed.
Right.
Because you're elevated, and you know the gravity is not going to affect, and you need it needs time to open up and breathe.
Yeah, you need to let your skin breathe a bit. Otherwise, it's going to be like a cast and just
Right.
die in there.
Now, let's bring your foot up. Put your foot down. Now, one thing that you may find happen is sometimes these will roll down, depending on the shape of your leg, and then you get this tourniquet effect. And so what you need to do is just roll it up again every now and then. If it happens a lot, or someone who has ever worn them may forget to correct them,
Yes.
what you do is you take something called Koban, which is this. And
Tape-like material, but it does not stick to your skin.
Right, and it's stretchy. It works very well. You can order this online. You can get it. Actually, it's exact same stuff the vets use on animals. Exact same. It's a lot cheaper if you buy it like a.
Calling me an animal?
Yes.
Oh.
All right. So all you do is you put this around, not tight. It stretches, but you don't put it on tight, and it only sticks to itself. As you can see, there was a good example of
Yes.
why we use it. Once you get it over the top of itself, then it sticks to itself. Works very nicely, and we'll cut that off in there. Now, the one problem that you may have with this is if you have a pair of shoes. Here, I'll give you my pair of shoes.
Oh, thanks.
And you put the shoes on, if they're snug shoes at all, this worked pretty good. Now, Crocs work pretty good. There's a lot of air room, a larger pair of Crocs. But what happens is it started to here. My mother has this problem. That's why I'm very aware of it. She puts her shoes on, and this will get pushed up like this, and it creates another tourniquet down there. So either loose slippers, shoes that are plenty wide so they can get your foot in there without having this push up. Works very well. Okay, and then again, wear them all day long, not at night. Have clean pairs so that, or 2 sets so that you can wash, wear them again the next day with a clean pair for obvious reasons, and you will have good results with this, but you have to do it every day. All right, and the second kind of compression sock, these have been very popular. They have the toe in them already. They do compress. They're a little more aggressive, probably for the younger crowd and more active people, whether it's just work or actually in an athletic event. They're very popular as well. One thing, you can buy them. Usually people buy them online. There's a lot of different manufacturers. Just make sure they're gradient. In other words, the compression is less around the top versus around the ankle. And they'll tell you in the description how many millimeters of mercury of compression. A good one for most people is like around 20 millimeters around the ankle, and then up around the calf, it's going to drop to 15. That takes the fluid and the circulation and pushes it proximal or up towards the core or the center of your body, so to speak. So that's important. Make sure you get the right size. Typically, they'll give you the size of the shoe related to the size of the sock, and there will be like 3 or 4 shoe sizes 7 through 8 or 10 or whatever I should say, that will fit. So make sure you get the right size. Make sure they are gradient and more compression on the ankle compared to the calf. And then you simply put them on. They do not go on real easy.
No,
That's typical.
I was struggling for about 5 minutes before we turned the camera back on to get mine on.
Wow.
So
it wasn't 5 minutes, Mike.
It felt like 5 minutes. It's just a little more work to put them on, but once they're on, they're pretty comfortable, actually. I
Right.
like these.
And after you put them on, you get a little system of, you want to put them on around the forefoot first and then
Yes.
bring them up, and there they go like this. Make sure you do get the wrinkles out. That is important, particularly if you have any diabetes. Now, I've had a pair, and again, like Mike says, they're quite comfortable. And you can wear, I've worn mine all day long. They feel great. But if they're too long and they go up past the knee, this is not too bad. I have another pair that goes up too much. And then what I do with these, I simply fold them down about 1 inch wide and then leave them there, and then they're comfortable. I wore these on a plane ride up to Alaska, and they were quite comfortable, except for those were a little long, so I had to pull them down and do this. Obviously, I'm not exercising in a plane, but in the plane is a good place. It's not a good place.
Say, why did you wear them in Alaska?
Well, because I was hiking up there.
Oh, gotcha.
I got varicose veins, and they help the circulation with hiking. But in a plane, it's possible that sitting for long periods of time for some people will put you at risk for a DVT or a blood clot. So that would be helpful in that situation. Because you're sitting in a plane, I couldn't do ankle pumps because my bag was stuffed up there under there.
Yeah.
My legs were cramped up pretty good. And 5-hour flight, that was a little lacking as far as mobility. I had to get up, go to the bathroom just to get some movement. But that's a whole nother story. All right, so again, these, wear them all day long. You're not going to wear them at night, obviously. For the active person, you don't want to exercise, you're going to find them comfortable. They're going to do the job of getting the swelling out of your ankles and up to where the circulation needs to be. I know a number of people that use these. The biggest disadvantage, I think, is they're not the easiest to get on, but they do the job. So
You can have some really bad tan lines, too, if you're wearing shorts.
oh, why the tan line? We don't care about that.
But these are machine washable, at least, but I would air dry them. I would not put them in the dryer.
Sure, exactly. Yep, be nice to your garments and they'll last longer. All right, very good. These are definitely going to help with pain. I have a lot of people talk about ankles and legs feeling better throughout the day when they wear these garments versus without. Goal achieved. Again, what do you say, Mike? Say something. Say something.
Something.
Okay, we're done. Have a good day. Keep those feet pain-free.